In this video, we will be riding the lateral flexion cervical spine. The lateral cervical spine should be performed with the patient standing or seated at the applied body. A 72-inch source to image distance is ID and no tube angulation, and it's perpendicular to IR. For flexion, we're going to have the patient bring his or her chin down forward his chest. And when we do this, this opens up the spinal surprises and the spaces in the back. So, for the flexion, we're going to have the patient pointing his or her chin down forward his chest, and the exposure is taken and must be free of motion and rotation. And the extension cervical spine should be performed with the patient standing or seated at the applied body. Again, 72 inches source to image distance is ID and no tube angulation. When we lift the chin all the way up for the extension, it closes those spaces, the opposite of flexion. And it must be free of motion and rotation. And both of them I mean extension and reflection. The central ray is perpendicular to IR. The collimation is adjusted to 10 × 12 inches. Place side marker in the collimated exposure field. And the required voltage for this exposure is 85 kV.